Sure. A geriatric care manager, for one thing, will come to the person's home. It it doesn't make any sense to bring an older person to a care manager's office because I don't need to see how they manage in my office. I need to see how they're managing at home, what obstacles are in their home, what challenges they have to getting to their car if they're still driving, or how remote a setting they're in as far as getting home care workers to them. So a care manager goes to their home because we want to be very practical and figure out what's going to improve the safety in their bathroom, and with grab bars and throw rugs and narrow doorways for wheelchairs and things like that, ramps that are needed outside a home. It's different from home care workers. We actually work with companies that provide home care workers, and we help to guide them and guide the companies we use to provide the optimal care for those individuals. Everyone has individual needs, specific to whether their vision is impaired or whether their mobility is impaired or whether they have speech or swallowing issues. It's all very individualized. And we work with family members and all the other resources that are out there, Meals on Wheels, and all those resources to fine-tune something specific to that person. And that's the difference between a case manager. Case manager primarily deals with insurance issues and what the insurance will pay for and what they won't pay for.
Okay.
So they're very close in phrasing, but they're different. Yes, as we always say, you never know what's behind anybody's door. There are families that don't realize always how much they contribute to the challenges that an older adult has to face every day. I've had situations where my recommendation really was to not provide any alcohol for the older adult, even though they were asking for it, or to really limit. Families may need to, for financial reasons, limit the number of hours a home care worker can be in the home, but it's not to the safety advantage of that older adult. And they need to talk to financial planners or reverse mortgage specialists or someone to provide the extra finances for that older adult to be safe at home. But sometimes you run into family members who are frightened or inexperienced or genuinely concerned that money's going to run out, and so that they won't work with me to realize what the needs are in the home and take advantage of the financial options that are out there. So that's another one. There's also family dynamics that have gone on for years and years in families that are almost impossible to change in some ways, but I find that there are times when you can help families organize who's going to do what child is going to be in charge of what piece of the needs for the older adult, and sometimes dividing up responsibilities helps so that nobody feels left out or kicked into the corner of the care needs, so they feel valuable, but some responsibilities that may be throwing a hook into the situation, we can move around them and use somebody else for certain services. There's 7 times the number of drug errors by people over 65, either because they are confused by the directions, or the directions are changed sometimes by the doctor on the phone and they forget which medicine changed. Coumadin is a medicine that so many people are on, and those dosages change on such a regular basis that it can be very confusing for people, and it can really cause some huge problems with bleeding or phlebitis or So there's also a very high rate of suicide. About 20% of those over 65 either consider or actively commit suicide. Social isolation, which is similar to what the veterans are going through, but more to a degree of they're finding a lot of loss of their peers, loss of friends, people that are chronically ill that aren't able to hop in the car and come and visit on a regular basis. So there's decreased mobility. It's much scarier to think about the ice on the sidewalk now than there was before, and it keeps people home. Depression, which is one of the changes that happens oftentimes as the brain ages. There's a decrease in serotonin, there's a decrease in some of the chemicals of the brain that contribute to depression, which is why many people with Alzheimer's or other memory disorders are put on an antidepressant to try and improve the chemical balances in the brain. So I would say depression, social isolation in particular, are the causes of suicide. Also, it may sound trite, but families, older adults don't want to be a burden on their children. They really sometimes find that as a way out so that they don't impact the rest of their families as much as they feel they are. Say if I had to generalize, women tend to be a little more flexible maybe, or a little more open to seeking medical advice, going to specialists, not fearing physicians. I think men traditionally have been working and not at the doctor's office as often. They also tend to be a little more staunch in their refusal to see doctors or to put off symptoms. Now, this is a generalization, certainly, but I do think also that there are some cultures that tend to seek medical advice more than other cultures.
Do you think that's because in some cultures there's more of a family connectivity from one generation to another, as opposed to in a more of a Western culture where it's do your own thing, we'll come together at certain times in the year. So that plays out then in how we look at health.
Right.
What health really means to us.
Right. I would say when families are closer, intergenerational families living in a home, maybe, for instance, like an Indian family, that where you might have many generations in the home, you tend to see that older adult being escorted by a daughter to a physician's appointment and being an extra set of ears in that appointment. So I think the acceptance of those medical changes and the incorporating that illness into the family structure and managing that is a very common thing that I see. But there are some cultures who maybe would have a more macho stance to things or an independent sort of stance to things, that an older male may be living alone and not be so inclined to run to the doctor if he was having chest pain, or might go for a glass of wine rather than decide that the doctor was really something that was needed. So yes, it's very individual. Culture certainly plays a role in the way people approach their seeking out medical attention.